think we're good to get started, folks. Okay. Well, good afternoon and welcome. Thank you for joining us today. My name is Claudia Trevor-Wright, and I am the Special Projects Coordinator for the Implementation Guide for Best Practices in Sexual Health in College Settings. Today, we're going to be looking at case studies implementing those best practices. This webinar is sponsored by Hologic Inc., and because of their support, we can bring this education to you at no cost. However, there are no continuing education credits available for today's webinar. It will be recorded, and if you've registered for it, you'll receive a link to the recording after. We can start by welcoming Blake Flahar, who will introduce the Sexual Health Promotion and Clinical Care Coalition, as well as the guidelines. After that, we'll meet today's speakers who will present the creative ways that they have been implementing the best practices at their institutions. And we'll wrap up today with plenty of time for Q&A. However, I encourage you to use the Q&A panel at the bottom of your screen if you have questions during the presentation. That function will be moderated by some members of ACHA's Coalition for Sexual Health Promotion and Clinical Care, and you'll meet those folks right now. So with that, I will hand it over to Blake.
Thank you, Claudia. Hello, everyone. Thank you so much for joining us today on this Friday afternoon. So my name is Blake Flahar, and I use he, him pronouns, and I'm the chair of the Sexual Health Promotion and Clinical Care Coalition. My day job is I'm the Sexual Health Promotion Specialist at University of California, Davis. And just to tell you a little bit about the coalition before we do some introductions is, we are a very active group within ACHA. Please join our coalition if you want to help develop educational materials, do consultations with folks who have questions about sexual health in college settings. Yeah, please get involved. We meet at the third Wednesdays at 8 a.m. Pacific. So now let's introduce some other folks. So if we want to do Jordan, Brandy, and Joanne, would you like to introduce yourselves?
Yes, hi everyone. My name is Jordan McCann, and I am the chair-elect for the coalition, and I work at James Madison University as the Interim Associate Director of Health Promotion and Wellbeing.
Hi, I can introduce myself. I'm Brandy Reeves, pronouns she, her, hers, and I am the director in the Student Wellness Center at the University of Cincinnati and the secretary / note taker of the coalition.
Hi, and I'm Joanne Brown. I'm a nurse practitioner at the University of Kentucky, and I'm the immediate past chair of the coalition. I'm glad to have everybody with us today.
Yeah, next slide, please. So the guidelines, you've probably heard a lot about these guidelines lately, but this was developed over a year and a half. It speaks to best practices in sexual health promotion and clinical care in college health settings, obviously through the lenses of public health and medicine. So that's what we're going to focus on. So read those guidelines on the guideline page on the ACHA website, and that's what these case studies are going to be based on today. So I will turn it over to Claudia.
Thanks, Blake. So as we mentioned, coming soon, there will be an implementation guide that accompanies the best practices. We're really looking forward to launching that and sharing it with all of you. But for now, we get to think about how our friends are implementing them as we speak. So it's my great pleasure to introduce today's speakers. Jordan McCann has already introduced herself, and we're so happy to have her here in both of those roles. Tanya Sullivan is the Assistant Clinical Director and a nurse practitioner at Brown University Health Services in Rhode Island. Jenna Emerson is a health and sexuality educator at the University of Vermont. Kim Petersen is a clinical nurse at the University of California, Davis Student Health Counseling Services in California. Each of these presenters brings a wealth of experience in the field to share with us today. And we are so, so grateful that these very, very busy folks are taking the time to share their insights with us, especially in light of the fact that all of them, like most of you, have really got their hands full managing COVID-19 on their campuses. So again, my heartfelt thanks to all of you for being here today. And now we get to start things off with Jordan. Thank you.
Yes, hello again. So my name is McCann. I use she, her pronouns. And like I said, I am at James Madison University, which is located in Harrisonburg, Virginia. We are a university of about 20,000 undergraduate students. And this current semester during COVID-19, we have had about 3,000 or so students still living on campus. Next slide, please. So prior to COVID, we only offered our safer sex products in person at our safer sex centers, as you can see pictured here. They're wall-mounted units, and we do have 6 locations throughout our campus. You can see we offer a variety of products, mostly external condoms. We have different sizes, flavored colors, non-latex, non-lubricated, and then the fun ones, the ones that can help increase stimulation. But we are also able to offer lubricant, including water-based, silicone-based, and flavored. And then we also include dental dams, finger cots, internal condoms, and gloves. So this time last year in the fall, our 2 busiest months were September and October, and we averaged about 174 visits to our safer sex centers. We gather that information by tracking the number of bags that we give away each week or that are taken each week. This is by no means a true representation of the total utilization, but it's our best attempt at how we can track the baseline number of visits to our safer sex centers. In person, the most popular products we offered were larger fit, glow in the dark, thin, standard, and textured or ribbed. And we were able to track that, just how often we are needing to refill our bins and also how often we're needing to order them. So kind of just by tracking the inventory of those products. Next slide, please. So starting this semester and due to COVID, we have adapted and started to offer our custom orders for safer sex products. We created a form using Microsoft Teams, and it's very similar to a Google form, but students are able to complete that form by scanning a QR code on their mobile phone or on our website. They are able to select a variety of up to 20 external condoms, 10 of each type of lubricant, and then we set limits of 5 internal condoms, 5 dental dams, and then 2 pairs of gloves or 2 bags of finger cots. The pickup options that we have for students currently are Monday, Wednesday, Friday, and that's really so we can just allow 24 hours for us to receive their order and then to fill it. Typically, we're able to do so in less time, and so we also ask if they would like, they can provide their email, and we'll send them an email letting them know that their order is ready prior to when they were wanting it. Sometimes this has been helpful, especially if they put an order in on like Thursday or Friday and want it on Monday. Sometimes they're able to get it in before the weekend. And so using this form too, what we have found is it's provided a space to allow students to almost kind of do a little bit more shopping. And we're able to provide information on the products there on the form. We have that currently in our in-person, but we know that students were not spending time reading the labels in front of them when they were in person in our office. So we definitely think that by having the information on the form, it's giving them more time to read and think about it and learn. And that's playing a role in the increase of our more non-traditional safer sex products. Next slide, please. So this is a picture of what our form looks like. Again, it looks pretty similar to Google. You can see at the beginning, we just kind of have our introduction, pretty much what the instructions are, where they'll pick it up, when they can pick it up, some things to know, kind of the limits of what we have on the products. And then we're able to put a picture that shows exactly what products we offer, including the brand. We do ask students to specify if they would like a specific brand or if they want specific colors or flavors. If students don't specify, we just make a note on their receipt and then they get whichever our volunteers pull out for them. Next slide, please. So our process is that once a form has been submitted, we have a full-time coordinator that every morning she goes in and checks that and then fills out the receipt that is then filled, done, or kind of like the shopping experience really, by one of our graduate assistants or our student volunteers. They are filling these orders almost every day, but we've been able to work out a schedule so that they come in kind of and start filling for the day coming up. Once the order is filled, it's marked with the last 4 digits of our students' ID numbers, and that's how they're able to identify which bag is theirs when they come to pick it up. And then if they did give us an email, we just use a quick parts template, which makes it super simple for us that we can just send it out saying, hey, your order is ready. You're welcome to come in anytime now and pick it up. We have had students not pick up their bags and their orders. We allow them to stay on our shelf basically for 2 weeks. We say that they have 1 week to come pick it up and then it'll be removed. But really, after that 1 week, we send them a gentle reminder saying we love that we ordered with us and it's still waiting for you to come pick it up. So please do so. If not, we just return it back to our inventory. Next slide, please. And so this is what the spreadsheet and kind of our process looks like behind the scenes. So on the right, you can see that that's kind of what shows up of what the students are ordering. And as I said, my full-time coordinator, she then takes that information and fills out the receipt, which is that picture on the bottom. We created just a nice little slip of paper there. So we mark whatever products they ordered. And then for us, kind of keeping the tracking process, we kind of denote by color coordinating when the order is coming up. So once an order is complete, it's then changed to green. Orange means it's the next coming day that we need to get it done. And then yellow would mean we've got a little bit more time. You can also see we mark off once the receipt's been filled out, and then when the order was actually filled, the email if they provided it, and then have they been emailed and has the bag been picked up. Usually about once or twice a week is when we've been going through and marking off if our bags have been picked up or not. And then on that receipt too, it's provided us another great example to promote our other sexual health resources. That's on the back side of it. And that whole slip, we kind of sign off on it. We put if we had any substitutions for them, and then that goes in the bag for the students. Next slide, please. So just a little bit of data statistics so far. This has gone beyond our initial expectations. We started this September 9th, so it's been just a little over 2 months, and we have had a total of 266 orders as of today. We had a completion rate of 90% so far, so only about 10% of our orders are not being picked up. Of those 266 orders, we've had 23 of those unique users be returners or students that have now started to put more than one order in. And we've also sent out a satisfaction survey, and it has said that the #1 reason that they've heard about the form is through word of mouth, and then also our potty mouth, which is our marketing flyer that we have in the restrooms. The most popular products now in person are a little different than what we were seeing in person. Standard being the #1, it's the most commonly requested one, and we've given out over 1,400 standard external condoms so far in these past 2 months. Prior, again, in person, we weren't using that one much at all. And so there's been a few other changes too, but glow in the dark, very popular. Water-based lubricant is now also very popular, and almost every order is getting that. And also from that satisfaction survey that we have sent out so far, we've seen majority have been female. It's about a 60-40 ratio, and over half of our users have been first-year students. So lessons learned and moving forward, if you are choosing and wanting to implement this, we definitely learned we had to limit the number, mostly of our dental dams and internal condoms. That's due to like our budget and being able to continue to provide and be sustainable that way. Students have also tried to put in multiple orders. And so we've also encouraged, like, here's your first order of 20. Let's try that out and pick up this bag first and then come back. So we do limit about once per week, depending on how many things that they have ordered at one time. And then also we've had to learn to be repetitive. Even though you have all your information of where to pick it up, when to pick it up, how you'll identify your bag, we still have questions asked. So just know that you'll probably, again, be flexible and accommodating, but put that information in the multiple places and you'll still get asked questions. But our student feedback, it's all been positive. The things that students have asked for are delivery options, which I know some universities and institutions have been able to adopt a delivery system. We have also had requests. So if you are considering this, we may consider adding more information on the products. Some specific requests have been to include the measurement and the sizes that each condom specifically can accommodate. So it's great to see our students are just wanting to have as much information as possible. And then also our positive feedback, students have just loved the anonymity of it, the ease of it, that it's discreet, that it's free. And they have said that, yes, they agree that having the information on the product has been able to inform their decision-making more. And so I'm happy to answer questions if you put those in the Q&A for this. And my email is also available at the end if you would like. But thank you all for taking this time with me.
Thank you so much, Jordan. And I think the Q&A is already happening for you. And with that, we get to turn it over to Tanya Sullivan.
Thank you, Claudia, and thank you, Jordan. That was fantastic. Next slide, please. I'm Tanya Sullivan. I'm the Assistant Director of Clinical Services and Health Services at Brown University. And I'm going to shift gears a little bit from health promotion and talk about sexual health telehealth visits, which have really come forward front and center with coronavirus. COVID has really been transformational in opening the doors for us to provide more telehealth visits and think creatively about how we see our students. A year ago, we were used to seeing students in person for visits, and that was how we were doing most of our sexual health visits. And now with limiting in-person visits to what's truly indicated for in-person, we're able to be more creative and innovative with using telemedicine. So at Brown University, we are using telemedicine visits for asymptomatic STI screening, for comprehensive contraceptive counseling, as well as for sexual health promotion and education, which we do a lot of. I'm sure you all do too. It's really shifted our workflow for STI testing. So whereas we used to be in a clinical exam room with a student and doing a lot of hands-on teaching, we are now doing that through Zoom and having students come into health services to perform self-collection for STI testing. And I know we'll get into that in a little more detail later on, but it's really transformed the way we work with our students and fostered a lot of independence and autonomy on their part, which has been really wonderful to work with them on. We do reserve in-person visits for symptomatic individuals and procedures. So if someone is having symptoms indicating they could have an STI, or they're interested in having a LARC inserted or removed or replaced, or if they need a procedure for treatment such as liquid nitrogen or cryotherapy, we're able to provide those visits in person while still accommodating a lot of other visits through telemedicine. Next slide, please. So these are some of our educational materials that we have created to help students navigate the world of self-collection. These are reviewed with students in detail during a telehealth visit when STI testing is being ordered, and they're also placed in our bathrooms on laminated sheets where students can use them as a guide. So students are provided with the collection materials by our medical assistants when they come in, and then they can collect their samples in the privacy of a bathroom and then bring everything to the lab. So we do promote rectal self-collection, vaginal swab self-collection, and urine self-collection, and pharyngeal self-collection. Next slide, please. With the coronavirus becoming a reality for all of us and present in our day-to-day world, we're certainly doing a lot more offering of self-collection pharyngeal swabs. And we do talk students through the collection technique for this. I would say early on in the pandemic, when we were doing different types of care, we were actually doing this donned in full PPE, but we've certainly shifted, as a lot of other healthcare providers have, to promoting student self-collection of pharyngeal gonorrhea chlamydia specimen collection. Next slide, please. So one thing I do want to touch upon that I think anyone who's working in primary care, specifically in the college health setting, can probably relate to is the fact that COVID has really flipped the world of assessment on its head. So where we were used to treating coughs and colds and flu and sore throats on a day-to-day basis in person, it's a different world. And now these visits are a combination of telemedicine and respiratory care, where we're donned in full PPE with face shields and N95 masks and gloves and gowns. And it can be easy to lose sight of the fact that sexually transmitted infections exist in a pandemic. And I want to emphasize that we can acknowledge and practice in both worlds and make sure that we're being comprehensive in our history taking, our physical assessment, as well as our lab testing and considerations of other differential diagnoses besides COVID. I will say the workflow is going to vary tremendously based on your institution and what resources you have and what workflows you have in place. I'll describe a few different options and scenarios, and it can apply to different environments depending on what resources you have. So some institutions are doing primarily telehealth for students who have any symptoms that could indicate COVID, including throat pain, myalgias, which are body aches, low-grade temperature. And I just encourage people to keep in mind that throat pain, myalgias, low-grade temperature can also be indicative of sexually transmitted infections, specifically pharyngeal chlamydia, pharyngeal gonorrhea, and acute HIV seroconversion. So there are different ways of assessing for these things in the context of coronavirus, because we certainly don't want anyone who is a healthcare provider to put themselves or their colleagues at risk. So there are a few different options. If you have the option of having a respiratory clinic in your or around your health services area, you can certainly add co-testing onto COVID testing. So in addition to testing someone for COVID, if the history is suggestive or is appropriate for, you can also send out a pharyngeal gonorrhea and chlamydia swab. There's a staged approach that one might choose to take, where you could do COVID testing first, get that result back, and then have a student come back in and perhaps perform a self-collection at that time for pharyngeal chlamydia or gonorrhea, in addition to having lab work done for HIV and other sexually transmitted infections. So it is a very different practice model and concept compared to what we were used to doing a year ago. But I do encourage those of you who are either doing work with students in primary care not related to COVID, or those of you who might be doing COVID care, to try to really also consider that not all symptoms of COVID are COVID, and that it is still an opportunity to explore the need for screening for sexually transmitted infections, especially in the presence of symptoms. Next slide, please. So I'll talk a little bit about a quality improvement project we did in health services shortly before COVID hit our campus, and it was aimed at increasing our HPV vaccination rates. And this really was inspired by the launch of the release of the guidelines that extended the age of candidacy for HPV vaccine to age 45. And the quality improvement project involved looking at ways to promote the Gardasil vaccine, and it was added onto a self-check-in registration screen in our electronic health record. So before students even stepped foot in the exam area space, they would say whether or not they were interested in receiving the vaccine. This was actually very successful with our flu vaccination prior to the HPV vaccine initiative. So it was a duplicated effort, but it was quite successful. One of our nurses and nurse practitioners also explored through staff surveys and reminders different ways to ensure providers were aware of and offering vaccines as indicated. So checking vaccine history and seeing where there was appropriateness to offer the HPV vaccine. And the nursing department would also schedule follow-up appointments at the time of the first visit. So that would help ensure adherence with completing the full series of the HPV vaccine. So with those interventions, our HPV vaccination rate increase was 66% when we compared 2 months prior to the initiative to 2 months during the intervention period. And in addition to that, looking at one sample intervention month and comparing it to the year prior intervention month, there was a 57% increase year to year. Next slide, please. And that brings me to some work that we can continue to do, whether it's in person or through telemedicine, despite the fact that we're all navigating a global pandemic of coronavirus. And that is really thinking about appropriate follow-up opportunities for our students. So in our health services, we have a positive STI result tracker to trigger notifications to students when they're due for repeat testing. And we are considering in that the CDC Dear Colleague guidance, which I believe most of you are aware of, that has impacted availability of, due to the lack of availability of some resources such as reagents and testing materials. Some of the standard 2015 CDC STI screening guidance has shifted, but we're still tracking students who have had positive test results and determining whether it's appropriate for them to be rescreened. I encourage everyone to still consider implementing expedited partner therapy where it is legal in your state. And encourage and provide access to barrier methods, even if it is through a telemedicine visit, thinking of those creative ways on campus, as Jordan mentioned, that students can access barrier methods, and making sure that there is intersectionality between your health promotion team and your clinical care team on campus. With PrEP, making sure that students do have the recommended follow-up. And again, applying the CDC Dear Colleague guidance to that follow-up, because some of those 3-month follow-up visits are actually a little more lenient now with the CDC changes. And then continue to answer questions that students have and offer education and listen with a third ear and look with a third eye and really give students your full attention when you're talking with them, even if it is on Zoom, even if your cat or dog or partner or children or other things are happening in the background. It is an opportunity for students to see a more human side of healthcare providers when they see you in your telehealth environment if you're home, but also making sure in that you're also giving them your undivided attention. Next slide. That's it.
All right.
Thank you so much, Tanya, and welcome, Jenna.
Thank you.
Thank you. Hi, my name is Jenna Emerson. I use she and her pronouns, and I work at the University of Vermont as a health and sexuality educator. The University of Vermont has about 12,000 students, and it's a predominantly white institution in a predominantly white state. So as we are in a pandemic of a virus, coronavirus, we are also in a racial injustice pandemic with anti-Blackness and racism. And so with the ACHA guidelines, I'm also going to be talking about ways that some of my programs, in my hope, is to dismantle some white supremacy culture. And seeing that this panel is a presumably all-white panel, just seeing ways that the sexuality, the field can also perpetuate a lot of white supremacy and whiteness in our field. So ways that we can combat that a bit. I also have a Facebook group called Sex Ed in Higher Ed that you can request to join. Not a lot of people post in there, but I think some people here are in it, and I love it. So we can go to the next slide. So I'll be talking about some programs that I do at the University of Vermont. So this one is the good stuff. So it's a peer-led positive sexuality discussion group. It's about 3 years old, and it started with a student who just said, where do we get positive sexuality? Where can we talk about the good stuff? So you'll see here some pictures from a workshop called Eating Pussy 101 that, yes, that went out to students. No parents ever called me. It's about an hour and 15 minutes, and it's drop-in. Right now we're doing it virtually on Teams, but we do have topics. So what it looks like is that it's informal, it's open, so it's not a closed group, and it is discussion and activity based. You can see us eating pussy with a little clementine. These pictures were, of course, pre-COVID. It's also mentorship based. So each student is given a mentor, me or my colleague Sarah, who are both trained sexuality educators, and it's a highly, highly supported program. What we do is we just build rapport, and also as leaders, we have 2 staff in there, like I said, me and my colleague, and we also participate and share. So one thing that we really try to do is dismantle the white supremacy culture of power hoarding and paternalism, right? So thinking that we know what's best for you, we know what you need to learn, and we only have access to the power. What we wanted to do is give students the identity as expert, right? They are experts in their lives, they are experts in their experiences, and giving them high support in guiding those conversations with their peers. All right, let's go to the next slide. So next is a program that I do probably once a semester. This one is specifically called Sex Under the Sheets because it is Halloween themed and sexy. Here you can see me dressed as the internal clitoris and my colleague Sarah, who is the rabbit vibrator. Name a better duo, all right? And so what we have there is just making it fun and making it really accessible for students. So we did do this, so this is 2019. We did do this virtually and it went really well. We actually got our most amount of numbers virtually. About 50 people showed up, which was incredible. And so some things to consider for best practices for anonymous question and answer. It doesn't have to be Halloween themed, but you should always be dressed as an internal clitoris. I don't make the rules, I'm sorry. It's homemade. Is really looking at diversity of panelists. So making sure that you have people who potentially identify as therapists, educators, nurses, BIPOC, Black, Indigenous, people of color, LGBTQ+ folks, gender variety. Another thing that we did for making it anonymous was having a registration link that went out over email. It's called Sex Ed in Higher Ed. We can put it in the chat too. So the registration link made it so that it's not an open link, right? So not just anyone can access it. We did open it to anyone with the link can sign up. So we did have a few people from other universities join us, but primarily it was UVM students. And if something were to go awry, we know all the emails. So I highly recommend that and sending out the email day of with the link. Also a huge, I cannot stress this enough, is do not let your participants see the anonymous questions. Okay, so I did one where it was a Google form that anyone could type in a question and we were looking at it and it went horribly wrong if anyone can type whatever they want into the form. So we had a separate form for anonymous questions just so that it goes through a moderator. So what they can do is combine, rewrite, or rephrase in a more affirming way, especially if there's language in there that may not be affirming or may be offensive to people. And so another thing that we did was we had the cameras and microphones muted, but we had them turn their cameras and microphones on for games, gave out prizes like books, lube packets, and vibrators, and just keeping it open, affirming, informal, and just really student-centered in those responses. But highly, highly recommend. This is a very easy program to put on. Most of it is just promotion and getting the panelists. And here, what we're trying to do is look at the community level and how we can challenge sex phobia. at the university level. All right, you can go to the next slide. Another thing that I do often is a positive sex ed workshop with sports, so club sports teams, fraternity and sorority life, things like that. And those are about an hour and a half long structured workshops. Some things that have worked for me is using Poll Everywhere has been a really great tool for keeping people engaged. And I also use that as an exit poll. So at the end, just so that you know if you're going to email out a link with a survey, 5% of people are going to do it, right? So what I do is I actually ask them, like, I learned more about the different facets of consent, agree, disagree, right? So I'm getting the evaluations in the moment at the end, and also what they've learned. I really like asking people what they've learned. So here what you'll see is we actually I had my intern who's a student, maybe on this call. Hi, Lily. She made a lesson plan called Choose Your Own Adventure. And what it does is it follows a relationship from meeting to going on a date to hooking up to engaging in seeing them multiple times and how you're going to navigate that, all through the lens of COVID and also safer sex practices. So what they do is they use Poll Everywhere, and they then at the end get a score. And using Poll Everywhere, I give them a group score of where they're at on the COVID risk level. It's kind of like I said, a BuzzQueef. Wow, that should be a that should be a website. BuzzFeed quiz, whatever. So here you can see low, medium, and high risk. So we can talk about where they're at. Most students have been in the low to medium low range, about 8 to 10 points. And we get to talk about what that means. So some things I do also is I used to be a high school teacher for sex ed, and I actually give the same lessons with just a different focus. So I do not have a link to show an example of it, but if you email me, I could definitely send you the slides. And another thing that I do that I've found to be really successful, one is really asking them to turn their cameras on. They're so much easier to talk to with cameras on. And I really stress that, even though, culture of consent we're building there, so I don't make it mandatory. And I also start my sessions with making assumptions. So assumptions that, we are living in a pandemic, racial injustice, elections, there's a lot going on, do what you can. And also assumptions that maybe they've never received positive sex ed before, shame-free sex ed. And we talk about that. And then I show lots of pictures of the internal clitoris because you gotta do what you gotta do. All right, the next slide, and my last one, is sex ed office hours. And this is where I provide one-on-one individual support. So this goes through, this is once a week. Students can sign up for 30 minutes to an hour. I block off about 2 hours. And this is just an opportunity for students to meet one-on-one drop-in. So I recommend this if you have someone who is a trained sexuality educator. I would not recommend a student doing these necessarily, unless you have they have a lot of support, or if it's peer-to-peer model. But this is an opportunity to talk with me. I make sure that they know it's confidential, they sign up online, and it's non-clinical, non-therapy. So what I end up doing and telling them what I do is I affirm, validate, listen judgmentally, and then I also provide information, reassurance, and then encourage those referrals. I give information of why something might be happening. And this is really where I talk to students mostly about pain during sex, erectile challenges, and relationships that are challenging. So those are three main topics that come up. Difficulty with orgasm, if they have a clitoris, is very common. And usually people are in a lot of distress and not knowing where to go. So it's really nice to see this visual of sex ed office hours. It goes across the university, and that just so that they know someone is there, sometimes is really helpful for knowing they're not alone and they can get the help they need. And so this is challenging some of the white supremacy culture that we tend to think that progress means bigger and more and quantity over quality, right? So really thinking about how we can have quality programming where I'm only talking to us one-on-one for an hour, but that conversation and that relationship is really deep and the information they get is really deep. That I'm not trying to get 20 students in a room to talk about vaginismus or something, and that might be really hard to do. And so the quality of this programming, where I may only see two people a week, and that takes 2 hours, but the quality is really high. And thank you so much. I think that's it.
Thank you so much, Jenna. And now we'll hear from our final case study. Kim, take it away.
Hi, my name's Kim, and I use the pronouns she and her, and I'm a staff nurse at UC Davis in Northern California. Thank you so much for all these great ideas and information. It's a lot to take in, so thank you. I'd like to share a nurse-driven STI screening program that we've implemented that has been well suited to this pandemic. 1 in 2 sexually active people are going to end up with an STI by the age of 25. One CDC survey showed about 12% of young people were actually tested in the last year. Next. But in our college health population, we do a little bit better, up to 28%. Next. I think in the college health population that they do feel more responsible for their own health, and that they honestly do want to start a new relationship on the right track. I hear that a lot for the reasons that they want to get tested. Next. But a lot of times they don't know how to get tested or what to be tested for. They're worried that their parents are going to find out. So there's a lot of barriers. Next. In 2018, we created a work group with all these folks in it, and tried to address some of these concerns. Next. I actually got to go to the College Health Association meeting in 2018, and I met Diane Peavy at this conference, and she shared what they were doing at the University of Texas. And I'm really grateful for her for showing me what was possible, that RNs could actually do this work. Next. So these are our data from 2015 and 2016. And this was before we really pushed forward with our online STI screening program. So we were at 156 online, and then the next year we had 284. So it wasn't very significant. And then the visits with the provider are actually in-person visits with a reason code for STI. So some of our data is a little bit confusing because a lot of times providers are ordering these when they come in for something else, and kind of, oh, by the way, but these were actually visits that were for STI testing. Next. So we used a focus group to kind of look at our electronic health record, and it was super confusing for students to schedule an appointment. And one of the best things that we did was put sexual, reproductive, urinary, or pelvic health right on the front page when you go to make an appointment. Next. And then there we are, STI HIV screening. Also, I just like to plug the PrEP button right above it, because when we started all this, we were told that it wasn't possible to have an appointment type called PrEP, but there it is. So never give up. So next. So the nurses are looking to do the people or take care of the folks that don't have any symptoms. Next. And have not been told that they've been exposed. So we want those folks to go to a provider. But if you answer no to both those questions, next. We're then going to give you an option that you can actually book an appointment with your PCP, or would you like to do the online STI questionnaire? Next. So this is our questionnaire. Right up front, we charge a $15 administrative fee for this service. Initially, it wasn't covered by the insurance, but now it is, which is super awesome. The questions are not mandatory, so we'll still do the testing even if you don't answer our questions. Next. But the questions are pretty specific, and they help us make recommendations about what folks should be tested for. And then if there's any we're concerned about pregnancy, we also put that in there as well. Next. And then here's what they check off what they want. And it's right up front how much it costs. And again, why it would be recommended. Next. A big piece of this was getting our self swabs in place. And we ended up doing a validation study. And now all of this happens in the lab. So that's pretty cool. They don't even have to come into the clinic. Next. So before we did the self swabs, we did 370 in clinic extragenital testing swabs. Next. And then it's pretty cool when it moved into lab. You can see that these are just ordered by nurses and by providers. And the students don't have to be seen in person. They can just go directly to the lab. And our numbers just kind of went through the roof. It's pretty cool. Next. We also have, this is a little bit out of order on my slides, I apologize, but we also plug prep again. So this is the second time that they're seeing it when they come to our online screening, and we have a text macro that we send if they're interested. Next. So with the nurses, we're following standardized procedures. We order the requested lab work. We make recommendations based on the way they answered the questions, and we provide information about prep and PEP if they are interested. Next. This is our template that really drives everything that we do, and it makes it very standardized. Next. So this is what happened between 2015 and 2018. And so the online requests went up, 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 and the in-person visits went down somewhat. So all of this is being taken care of online. Next. And at our clinic, chlamydia goes with gonorrhea, our testing. So those numbers for chlamydia would be the same for gonorrhea. And then our HIV testing and syphilis. We're in a county that has a high incident of syphilis. And so if you're requesting an HIV test, we are recommending that you get a syphilis test just because of that public health issue in our county. And so we're kind of right there with those numbers. Next. So we're getting HIV testing is pretty much done for every person that requests STI testing in the nursing clinic. Next. And, you know, again, you can see that the unique, the STI and the HIV testing is pretty much consistent with the nursing department, that we're ordering a lot of HIV testing on our patients just based on the CDC criteria. Next. I think this is a similar slide, but again, we're kind of high at the, wait. Oh, go ahead, sorry, that's good, next. Yeah, and so again, this slide just shows that we we've increased the number of people that we're testing really significantly through this online process. And in this era of COVID, we're able to keep them out of the clinic. And the more we advertise it, the more. So 2018 is when we finally started advertising it because we had enough staff to do the work. Next. And this shows you how they can go online and do it. And that really drives everything to the nursing box if they're interested. So I will go ahead and close it there so that we can take time for questions. Thank you so much.
Thank you so much, Kim, and thank you, everybody. That was the fastest 50 minutes because everything you just all talked about was so incredibly interesting. So silent applause for all of our presenters, and I can see that our Q&A box has been moving, but we can open it up for questions now for live Q&A. So if you have a question, you can either type it into the Q&A, or I believe we can unmute ourselves. Robin? See lots of thanks and applause. While we're figuring that out, I have a question that I'd like to pose to the panelists, which is, thinking about silver linings and trying to be positive in our work. I think I'd love to hear from you all. What is one thing that you've had to adapt in your practice during COVID times that you would like to keep once, let's dream big, once COVID is over? So what's something you would like to stay? Any of you can take that. You should be able to unmute yourselves. Yep.
Yeah, I was just gonna say, we have certainly kind of deemed our online custom order shopping experience as a COVID bonus, because it's something that we just, it was very feasible to do, but we just didn't really think that there was a need or students would want it. But now seeing it and seeing the feedback, we're like, of course they wanted something that they could do on their phone at home and just easily come in and pick up the bags. As much as we want to destigmatize students coming into a space to get safer sex products, we keep encouraging that, like, no, we don't care. We're happy you're here. We're happy you're using them. I would love to have that, but I understand that some students are not there yet. And so if we can still provide a service that allows for that anonymity and ease of them to come in and just grab and go, we are certainly going to continue providing this service.
I think for us at UC Davis, it really catapulted us into the telehealth. I don't think we ever would have gotten here so quickly. And it's, I think, really a positive thing to be able to interact with people over the phone, or if they're more comfortable with video, and even online to kind of meet the needs of more folks.
I'll echo that, Kim, and say I think the pandemic has allowed us to be more innovative and creative in the way we're reaching students, and because it's been able to happen really fast. Sometimes things can seem like they take a long time. To Kim's point about, implementing something that's a new project can sometimes feel like you're steering a barge, but all of a sudden with the COVID pace has really picked up, and yes, it can be exhausting, but when you're inspired and energized by working with your colleagues and being innovative and seeing some of the successes with students, then I think it is a nice thing. I'm not sure that we're going to want to let that go when the pandemic is in the rearview mirror, which it will be someday.
Well, the good news is coming, and we want it to keep coming. So, Jenna, any thoughts before we open up to more questions?
I'm busy typing away.
I know.
You said what do we want to stay?
Yes. What's something that's been innovative in your work in adapting to COVID-19 that you think you would like to keep, even when we don't have to follow these restrictions?
Honestly, it's not preferable to do online workshops, but I really like the chat features and things that we can do online that in person is really hard for engagement. And I also really like being home doing it. Not gonna lie, doing those late night programs, 7:30 to 9 p.m. and not leaving my house, I would like that to stay. But I would like to be in person. But I actually think that sex ed Q&A did probably better, I would say, virtually than it did in person. I don't know why, but the webinar formats just seem to offer us those opportunities. And then people can use the chat, where it would have been like side conversations that we would not have had those conversations. So I like the chat features. I don't know how to make that permanent.
Yeah, I agree with Jenna. We also did just a Q&A panel. We called it Sex Ed for the College Bed, and had a few different pro staff and students on it. And we had like 160, which was more than any of our in-person. And I think we saw such great response rate because of that, again, anonymous Q&A, being able to ask questions, which again, as much as we would love students to feel comfortable to raise their hand and ask about like vulval health, or how do I talk to my partner about this, I also understand as a first year, you're not comfortable doing that. So providing an option and space for that to feel like I can get the answers I want, and using that chat directly for clarification, I think we also had really great success for that. And we were like, oh yeah, we used to think no one would want virtual, but that was actually something that being virtual did help in the success.
Great. So audience members, feel free to ask your question in the Q&A box, and I will read it to our panelists who can also see that. Any questions?
Claudia, this is Joanna.
Yes.
Tanya. Tanya, where, after you see your patients via telehealth, where do they go to provide their self-collected specimens? We're having a challenge with that.
You are muted.
What could you repeat the question? I heard the second part, but not the first part.
So we're also doing those telehealth appointments, particularly for the asymptomatic students. But one of the challenges we're facing is I'll order the lab, and sometimes they don't come and actually provide the specimen. So where are your students going to provide the specimen? Are they going directly to the lab? Are they coming to your clinic? Are you sending them out? Like, how are they providing the specimens?
That's a great question, Joanne. Most of the time our students are coming into our health services, and we wrote up a protocol and trained our medical assistants to prepare a specimen bag, essentially, that had the labels and the supplies that the student needs. And then we have a kind of a quality control process in place where after a month's time, if a student has not come, then the provider gets notified that the labs are what we call non-compliant. But we try to incorporate our medical assistants, who are really great about providing some education to students when they do come in. But it does require tracking and follow up on the ordering provider's part, for sure.
Thanks.
Any other last quick questions in our last minute or two? I am curious, if I may close it out with the question of, what's one thing you're looking forward to do when it comes to sexual health post-pandemic that you haven't been able to do? Dream big.
Other than engage in our own sexual activity? LOL.
We wish for sexual health for everyone.
I really do, and I think that my dream big is just really simple. Is just I've never taught sexual health without talking about the need for like the loneliness and skin hunger and fantasies, and and it's beyond sexual health itself, right? Beyond condom distribution or whatever. But really thinking of these ways that as humans, we just want to be loved and feel protected. And during this time, it's really hard. And so mental health challenges are rampant. So what I'm just hoping after post-pandemic is like, I just want people to be able to like hug and be with friends and just like love up on each other, like in person. And in the meantime, come out of this with just more and more self-love than we came in with it.
Jenna, thank you. Ever so quickly, any last words, my friends? I'm also looking forward to the hugs for all of our sakes. Well, I will just say thank you to all of our panelists. Thank you to the folks who are working the Q&A throughout this session. Thank you to all of you for coming to join us on this Friday afternoon to continue to do the amazing work that you do in the world. Thank you to Hologic for sponsoring this webinar, and everyone who is working to keep sexual health a priority, even in the midst of this COVID crazy. Have a wonderful weekend, everybody. Thank you, and we hope to see you soon.